Greetings, welcome to In-Depth. I'm Dike Rostant. We are inside a month used to highlight a great deal of issues, and we are speaking with someone who epitomizes excellence while even making her mark in a field where she represents a minority. Dr. Natalie Johnson is a breast and oncoplastic surgeon. She's a daughter of the soil based at the Royal Marsden in the UK, the world's first hospital dedicated to cancer diagnosis, treatment, research, and education. She joins us to discuss breast cancer awareness and initiatives she is working on that are groundbreaking. Dr. Johnson, how are you doing? Thank you so much for joining us.
Hello, thanks for having me. I'm fine, thank you very much. And yourself?
I'm all right, thank you. Very happy to dive into this conversation. And when I hear oncoplastic surgeon, I break that down into oncology and plastic surgery. But at the same time, please define it and let me know what the field entails. Thank you.
Okay, oncoplastic surgery is a simple way of defining not just removing the cancer from the breast, but reshaping the breast so that the woman is not left with a deformity. And there's so many different ways of doing that. But breast cancer, because we're screening more, we're detecting cancer earlier. We don't just take out the lump anymore. We don't just perform a mastectomy anymore. Now we offer the women some quality of life by reshaping the breast. And that's where the oncoplastic side comes in. Because plain plastic surgery has nothing to do with cancer. It's just to deal with aesthetics or adjustments as per needed.
And is this a popular field? Because normally when I hear breast cancer, if it's not just a lumpectomy, it's a mastectomy, as opposed to that reshaping that you're talking about. So how many people are in this kind of field from your experience?
Well, to tell you the honest truth, it depends on where you are geographically. Here in the United Kingdom, really and truly, there shouldn't be anybody having surgery that isn't of an oncoplastic option, just because it's not just about taking out the cancer. You need to assist the woman in whatever way possible to make her feel as normal as possible. So oncoplastic surgery may mean you take out the lump, reshape the breast, or if you perform a mastectomy, you offer the woman reconstruction, meaning she has an implant to give her another breast, or she uses her own body in order to form a new breast. So modern day surgery, and most of the surgeons in this country, Europe and the United States, perform oncoplastic surgery and not just removal of the lump. So it really depends on where you are and if your surgeons are trained in that aspect of the operation. And the title itself probably sounds more complex, but it's a really significant part of the treatment.
Now, you say that, and you say that there isn't anyone, at least in the UK, who should have to go through something without having oncoplastic being an option. Can you speak to Trinidad and Tobago? Because the way you say it, and it sounds like it's just yeah, man, this is something that we do. My experience and what I've been hearing, and naturally, and it's anecdotal, but at the same time, it feels a little different in Trinidad and Tobago. This is just from my experience, though.
Right. So I think what is needed, obviously, is resources and education. So I can't speak on behalf of the surgeons that are there. I'm sure they are obviously following and keeping up to date with what's happening with the rest of the world. However, they should be offering a woman the options and letting her know this is what we should do based on the cancer you have, and obviously not just using a one-size-fits-all where everybody gets a mastectomy regardless of the size, because that has a huge impact on the rest of the woman's life and how she sees herself, the psychological stress associated with it, family dynamics, social relationships. So I'm sure they're on the case, but definitely, I mean, the point of it is to keep abreast and educate yourself into what you should be offering the patient. Ask yourself, is this what I would do for my mother or my sister?
And you're saying that, and I refuse to call it triggering, Dr. Johnson, but at the same time, this carries me back to having immediate family members having different types of cancers. And one of them, my sister, they were saying, okay, well, we're just going to take off this leg. versus saying what else could be done. But with that in mind though, and I'm moving away from that a little bit, what is a softie?
Okay, so a softie is a temporary prosthesis that we offer to women after they've had a mastectomy, meaning they've had to remove the entire breast, and for either reasons of illness or personal choice, they do not have a reconstruction on that side. So it's to give that woman that symmetry or a breast mound to make them feel a bit more normal under their clothing. And of course, that has after effects of building their confidence and helping them to feel a little less disfigured.
And it's one thing to have a bandage that is labeled on the box flesh toned, but you say my flesh don't look like that. But I think it's a very different thing is in terms of like expanding it to such an nth degree to have a softie that doesn't look like the rest of you, but what actually flipped that switch for you and saying, as opposed to just saying these don't match, saying, well, this is something that I want to be a part of, to make things that do match and have different tones, women of color, and to be part of that solution?
Absolutely. So it's as you said, I mean, the need has always been there in prosthetics, in Band-Aid, in what we call nude lingerie, nude underwear, any sort of adjunct that pertains to people of color hasn't yet caught on for whatever reason. And because I was aware that the need was there, and I have colleagues who were also very well in the know, because we got feedback from patients, it was about getting into the circumstance where we could actually effect a change. And as I was mentioning today to someone else, we needed to have ourselves in the system in order that we could create that change. And before today, because a lot of people ask, why hasn't it been done before? Before today, we were not a part of the system that we could create it for ourselves, so to speak. So my triggering point, I mean, two years ago, I called the company that created the softies, Nubian Skin. And I said to Ade, she's the founder, Ade Hassan, and I said, there's a need for this. Patients are asking for it. Can we work on doing something together? At the time, I didn't have the funding. And fortunately, via the Royal Marsden Cancer Charity, I think they deliberated for about 5 minutes and said, yes, why is this not a thing? How is it we don't already have this? How much money do you need? When and where? And we had, on top of that, we had the support from the Royal Marsden Hospital. And you need to have an ally in this form that would support it and is open-minded. And it was an immediate reaction and immediate support from everybody around us. And here we are, you know, almost 18 months later, with product in hand, giving it to our patients. And the response has been phenomenal. Patients spoke out, but on a very low level. Culturally, we're very shy about talking about disease. We're very shy about mentioning to our family that this is the problem. We're shy about checking because we're not sure we want to know. There are trust issues with doctors as well, historically and now. So patients were grumbling about it, but they hadn't vocalized, this doesn't match me. They would just throw it away or not use it. And that had huge repercussions for them afterwards. They just wore awkward clothing, or they didn't bother to go out, or it didn't boost their confidence. So we thought this is the time to make the change while we're in the system. We have the right support. We have the open-mindedness of the hospital and the Royal Marsden Cancer Charity. And now we have softies in hand. So you could tell I'm very, very happy about this. I'm really, really pleased that we've gotten to this stage.
And we want to dive into some of that enthusiasm. When we return from this break, we are speaking with Dr. Natalie Johnson, a breast and oncoplastic surgeon, about a range of things, and we're doing it inside the month of October, which makes it even more significant. But stay with us. We'll return with more. Welcome back. We are speaking with Dr. Natalie Johnson, a breast and oncoplastic surgeon. And just before we took the break, you were saying that there were allies that came on board and saying, why is this not a thing? Let's do it. And you gave me a timeline. We'll get to that timeline just now. But are there stats saying that women of color have lower levels of breast cancer than other people? What are some of the reasons possibly that you think that this wasn't a thing as yet?
Well, there are two things there. Yes, absolutely. Women of color tend to present with a more aggressive type of cancer for a few reasons. One, they tend to present late. Maybe because of the lack of confidence, they tend not to present to their doctors, or they don't think they will be listened to. Geographically, depends on who they present to, whether they have the resources in place and the threshold to say, you found something abnormal in your breast, we're going to take it seriously and investigate. Secondly, we tend to have biologically a more aggressive type of cancer in the breast. So many of our women require chemotherapy, or at the age they present, they usually end up needing a mastectomy or more extensive surgery. So it's a twofold reason why this is happening. And the statistics are out there. The literature is out there to show it, which is why this is even more important that we make the aftercare, the survival journey, more bespoke.
And I really like the fact about saying, okay, well, currently there are individuals in the system who see this as a gap and are working towards filling that. What are the next steps in terms of, are you working on distribution that is a little wider? And while we're speaking, I'm also thinking about Fenty Beauty products, because apparently it wasn't a thing until someone else started to do it, and then individuals. So, okay, well, apart from just there being a need, this is making money. So what are the next steps?
So the next steps, currently it's available for Royal Marsden patients, which is one of the top 5 hospitals ranking in the world. So we have a huge demographic of patients. It's not just African, it's Asian, it's Arabic women who are coming from, any what we call minority ethnicity that presents here, given that it is a cancer center. So of course we have this demographic. As you mentioned, the Fenty, the colors that were created by Nubian Skin started with the founder Ade going to these stores and looking at foundations and trying to match the colors in order to get the correct skin tone, not just a brown or a shade of brown, skin tone colors, meaning it had to mimic exactly what it looks like. So yeah, I think the next steps for us is to get it into the wider NHS so that all hospitals offer this to their patients as part of their treatment. So now when you come for your counseling, for your surgery and your mastectomy, you are given a swatch, you're color matched. And when you leave here, you feel confident that yes, my care is catered to me. I can trust these people because they're not just giving me a bog standard option. Further to that, we're still in negotiations with Nubian Skin to get this available internationally, as well as within the private sector. But again, it should naturally encompass what a patient is offered, because we have been giving this to patients for years. They just did not cater to a wider demographic.
No, Dr. Johnson, you're speaking to me and I'm feeling emotional. I have no onions to blame, but in terms of feedback from individuals that you have dealt with, because I can just imagine individuals feeling seen, feeling heard, and that making so much of a difference. What are some of the things that you hear from individuals when they get that color swatch and they're saying, okay, there's a thing, especially if they may have heard from someone else who would have thrown away a softie that didn't match them? What are you hearing?
So, believe it or not, I'm keeping it together, because every interview I've done thus far, there's never a dry eye in the room. It is such a personal thing. It is such an emotional thing. And it is a thing that would change lives for a lot of women in how they see medicine and how they trust their care is being taken, and how, as you said, how they feel being seen, included. And it's been phenomenal, the response. Patients couldn't believe, first they couldn't believe they were not just offered one color, they were offered 4 colors, so it's a wider range. And then they felt, I wish my cousin or my friend who had breast cancer was here to see this, because they would have liked to have had this offered to them and they weren't. So it brings up a lot of emotion. They're extremely grateful, and it makes us feel it was worth doing it. And we're so glad we actually, followed through with getting it done. I mean, for the wider public as well, people are super impressed that, yes, we didn't know this was a thing, and now it's there. And it's the first of its kind in the United Kingdom. I don't know that it is in the Caribbean or in Asia or Africa, but for us, we knew that it didn't exist here, and we needed to go forward and try and create it, because that simple change made it amazing for these women's experience as part of the start of their journey. So they're grateful, and we're happy that they feel a little bit more cared for in their recovery period.
Well, you said you're not sure if it's a thing. I know I don't patrol the hallways of hospitals, but what I have heard is there would be people who would get tattoos. There'll be people who have those sorts of pigmentation sometimes, but I've never heard of softies.
Yeah.
But even moving through, looking at the fact that you said many times when someone finally gets checked, what presents is a lot more later stage and possibly
That's right.
aggressive. Speak to that, please, especially as it pertains to women of color.
So I think particularly with women of color, we have a lot of myths around medicine. We have a lot of fears around seeing the doctor, apart from things like needle phobia, our fear of surgery, our fear of chemotherapy. Culturally, we worry that if we can avoid that and we can find an alternative way to heal, we choose that instead. This is not the majority, but it delays women from presenting. And especially now that we're screening, we're also not as good as going to see our doctor. Go and get that mammogram every 3 years from the age of 50. Do not miss that appointment. Check your breasts. You shower every day, you moisturize every day. That is part of your natural process. You will be feeling your breast automatically. If something changes, you're the first person to pick it up. You know your body better than anybody else. And you present to your doctor and say, I felt something abnormal, whether it be a rash on your nipple, a discharge, a bloody discharge, you feel a lump, go to the doctor and let them check it out. There are certain signs that you need to look for. Don't ignore them. We're trying to get away from the days where women presented with a cancer eroding through their skin. Again, women of color. And this is all surrounded by the myths and concerns that they have. So what I would say to women are, be breast aware, check your breasts. If you're not sure what to look for, ask your doctor. This is Breast Cancer Awareness Month. It's also Black History Month, but for us here, but it's Breast Cancer Awareness Month. So this is the time to check if you've never checked before. And there are many online resources in order to access what I should do. And encourage those women in your life. The other thing is find out your family history. Do you have a grandmother, a sister, an aunt who might have had breast disease in the past or breast cancer on your father's side of the family? Because a lot of it is genetic. So you need to find out as well. And I can't stress enough, get it looked after. You never know, you might be absolutely fine, but then you have that reassurance that it's negative rather than presenting later when we have to do more aggressive surgery.
So we want to thank you so much, Dr. Natalie Johnson, for the work that you are doing and just letting us know some things that we should be aware of. And on behalf of the entire TTT News team, I'm Dike Rostant. This has been In Depth with me. Thank you so much for joining us.